Let's do a small little tutorial of kinds on what an ICD is and who should get one. An ICD is an implantable cardiac defibrillator. It is something that you implant in patients, commonly in someone who's had an abnormal rhythm called a ventricular arrhythmia, or in someone who has had a previous sudden cardiac arrest. It makes sense to implant it in those patients because those patients have already once shown to us that they are likely to have life-threatening abnormal rhythms coming from the lower chamber of the heart. Now, in some other patients, even without having either a sudden cardiac arrest or an abnormal rhythm called the ventricular tachycardia coming from the lower chambers of the heart, we want to implant this ICD. Who are those patients? These are patients in whom the pumping function of the heart is less than 35% and they have some symptoms of the underlying heart failure. These patients are more prone than the normal patients to have sudden cardiac arrest. Therefore, as a preventive measure, we implant an ICD in these patients. So if you have a pumping function of your heart less than 35%, you might want to go visit your electrophysiologist to see if you are a candidate for the ICD. Very rarely, very young people having a condition called hypertrophic cardiomyopathy with a thickening of the heart muscle may require this device. Those patients are also requested to visit with an electrophysiologist to find out whether they should have an ICD. It seems rather challenging to have a procedure done when one is healthy, but because the survival rates of out-of-hospital cardiac arrest are so abysmal, it is very critical that we implant an ICD in patients who, by current guidelines, are patients or are candidates for implanting the same. It is said that if we implant 17 ICDs, we can save one life. Compare that to the use of common medications in which it's close to 200 to 250 patients where they have to be used before they can save one life.